Hi, my name is Damien, and today we're going to be going over antibiotics and two of its classes. The two classes we're going to be going over today are going to be about aminoglycosides and cephalosporins. So, to start things off, we're going to be talking about aminoglycosides. So, aminoglycosides are antibiotics that are used to treat infections primarily caused by aerobic gram negative bacteria. The way this mechanism works is that it inhibits protein synthesis in susceptible strains of gram negative bacteria, in turn, disrupting the functional integrity of the cell membrane and causing cell death. So, the route we usually go with this antibiotic is going to be either IV or intramuscular. And this is because when using these routes, the onset is usually rapid. The peak levels of this antibiotic usually are around 30 to 90 minutes after administration, and the average half life takes about 2 to 3 hours, and it's primarily excreted through the urine. So, some cautionary measures to take when taking this medication or this class of medication is to be aware if you have any allergies to the specific class of antibiotics, as well as taking extreme caution when being pregnant, as it could have adverse side effects for the fetus. Some potential nephrotoxicity and even ototoxicity due to damage of the eighth cranial nerve can occur, as well as some GI effects such as nausea, vomiting, diarrhea, and even weight loss, as well as some cardiac adverse side effects such as palpitations, hypotension, hypertension, and also hypersensitivity. Some clinical drug interactions. There's both synergistic and as well antagonistic um, effects. As for the synergistic effects, usually when used with penicillin and cephalosporin, the effects of this drug are positively augmented so that the drug works even better than it already does on its own. As for some antagonistic drug interactions, we have some loop diuretics, nephrotoxic medications, anesthetics, and neuromuscular blockers. So be wary of those other medications while taking this class of antibiotics. Now, moving on over to the second class we're going to be talking about today, it's going to be cephalosporins. So, cephalosporins are a type of beta lactam antibiotic that were first introduced in the 1960s. So, it's similar to penicillin in its structure and activity. So, there's various types of cephalosporins. There's first generation, second generation, third generation, and even fourth generation, as well as some outliers outside of these four generations that don't really fall under either of the four categories. So we're going to start off by talking about the first generation. So first generation is largely effective against the same gram-positive bacteria that penicillin affects, as well as some gram-negative bacteria. And then moving on to second generation. Second generation is effective against almost all previous strains of bacteria stated in the last generation, which was the first generation, as well as a few additional strains, although it is less effective against some gram-positive bacteria. Now moving on to third generation. Third generation is effective against all previous two-generation bacterial strains, although it is less effective against gram-positive bacteria, but more effective against the gram-negative bacteria. In the fourth generation, also known as cefepime, as it's the only antibiotic in this generation category, it's effective against both positive and negative gram bacteria. In general, a good thing to take note of is as the number of generation rises, we have three things that go on. This is the way to distinguish each generation. So as the generation rises, we see medication is likely to reach the cerebrospinal fluid, be less susceptible to beta lactamase destruction, and also the effectiveness against gram-negative bacteria goes up. Some indications um, of this drug are that treatment of respiratory, dermatological, urinary, and middle ear infections from bacteria are the primary targets when using this class. So, what the action of this drug or this class of drugs is that it inhibits the synthesis of bacterial cell walls, causing cell death in susceptible bacteria. So, the route of this drug is usually administered through the mouth. And the peak levels of this drug usually are around the 30 to 60-minute mark after administration. And it usually lasts about 8 to 10 hours. And the half-life usually lasts about 30 to 60 minutes, and primarily the drug is excreted through the urine. Some caution while taking this drug should be obviously some allergies to cephalosporin as well as penicillin, as its structural integrity is basically the same. So if you're going to be taking this drug, make sure you know that you're not allergic to either the drug we're talking about, which is cephalosporin, or penicillin. Hepatic or renal impairment is also another crutch when using this drug, as the liver and the kidneys are the primary processing organs of this drug. So any impairment there could cause toxicity to either the liver or the kidneys. Some possible toxicities in infants and even the fetus in pregnant or lactating women should be taken into account when taking cephalosporin. Some drug interactions that I found are some adverse reactions when taking aminoglycosides is the increased risk of nephrotoxicity, as both aminoglycosides and cephalosporins are both processed by the kidneys. So if you're taking both of these classes of drugs at the same time in 2 to 3 weeks time, back to back, you could cause nephrotoxicity and in turn cause organ damage. Also, while taking warfarin, something to take into account is that it may increase bleeding in the gut or anywhere else in general, just due to the fact that the cephalosporin interacts with the warfarin in that way. So that's pretty much it on these two classes. We're going to have more classes as we go on, but today we're just going to go over these two. So I'd like to thank you for tuning in and staying this long into the video. I'm hoping you got a little bit of information out of this and that it helps you out in your day-to-day nursing world, As always, I'm Damien, and thanks for watching my videos.